Okay, so for my internship project, I did a needs assessment for Baldwin County, specifically adolescents. So for characteristics of the population, the county has a population of about 43,000 people. And as of 2022, there was only 4.6% of this population that was under 5 years old. That number does seem small, but when you look more into it and compare it to other ages in the US, it's not that small. So that is the percentage of the population that, again, is under 5 years of age. And around 54% of the population is white, 42% is Black or African American, 0.4 is Asian, and 2.9 are Hispanic. So there's not much of a difference between the races when it comes to whites and African Americans, with it only being about a 10% difference, not even that. And then obviously the Asian and Hispanic population is a bit lower than that, so that's where our minorities lie. And the median household income for a normal family is $54,699, and the per capita income in the past 12 months was $31,681. So I'm going to talk a little bit about the measures of health in Baldwin County specifically. So all this information is from 2022 because it's the most recent information that I could find. But 11.6 of the infants were born with low birth weights in the year of 2022. So again, that's a pretty high number. When we're talking about birth weight, we obviously want to keep those numbers on the lower side, and 11 being, a higher number for that category. So that's one thing that the county is, trying to work on, getting mothers to make sure their nutrition, their health is being taken care of. And we'll get into why that's harder for them later on. But that was of just Baldwin County, and the overall of Georgia is 10.6. So there's exactly a 10% difference there. And this kind of just like shows that a lot of babies in Baldwin County are actually born with low birth weight, which there is a connection to that and why that happens. But during the same year, the mortality rate was 3 children per 1,000 births. Again, doesn't seem very, very big. Obviously, it'd be better if that number's at 0, but it's not. Around 5.6 of the children in Baldwin County had to live without any form of health insurance. So that makes, again, it harder for these children to be taken care of and to see their doctor, because obviously copays are so high. But they have put different programs in to kind of assess that, help with that. For example, where here at the ELC we have the Beacon Clinic, where they're able to see kids who aren't necessarily registered at the ELC, but in Baldwin County, if they're sick and they don't have a primary care doctor, they can come in here and get what they need, get a prescription. So that's something that specifically the Early Learning Center has done. The WIC program is a nutrition program for women, infants, and children. Obviously, like I said before, this birth weight is a huge issue and something that is a health priority in Baldwin County, so that's something that we're working on. But this is from these individuals from low-income households, and it provides them these benefits, whether it's food stamps, co-ops, that kind of thing. They're being provided with benefits toward their nutritional value. So that has been something that's been big. And in Baldwin County, children ages 0 to 4 are enrolled in the WIC program. It's around 743 people. So that doesn't seem like a big number, but when you truly think about it, 743 people are not getting the nutrition they need and are having to be helped by a program. And Baldwin County has an overall health rate of 43, so it could be better, could be worse, but there are programs and plans that are being put into place so that this doesn't happen. Alright, so this is just measures of health continued. Following the COVID-19 pandemic, children in Baldwin County were affected disproportionately because of the increase of social distancing and not being able to go into school. Many of these students had to rely on the internet to be able to get on those Zoom calls. With this being said, a lot of these kids weren't able to learn because they didn't have access to internet at home. Around 16% of the adolescent population in Baldwin County didn't have access. So that's a big percent. 16 is a big percent of those compared to who had access. Obviously is larger, but there was still that difference there. So due to the lack of this, they were set back on their education. This put them back behaviorally, socially, mentally, all that kind of stuff, academically. So that's something that we've had to work on. Us being, the ELC and the staff here at the ELC has had to work on providing that for those children. And as it compares to the overall rate of children in Georgia, 74.6% of children in this country are enrolled in a pre-K program, in this county, are enrolled in a pre-K program, while 55.3% are enrolled in Georgia overall. So 74 is a good percentage, and it's higher than Georgia's overall percentage. Obviously, there are places in Baldwin County, such as the ELC, pre-K programs like that, that really facilitate to the children's needs. So this is another measures of health continue. Pre-K programs are extremely recommended in Baldwin County, and there are even programs and facilities for children from low-income families. 67% of children from low-income families are enrolled in pre-K compared to 43.8% of the overall rate in Georgia. So again, very much higher percentage, being 20%. And although these programs are popular in this county, there's still a high rate of those that are not enrolled. So that's again what educators and people in the community have been working towards, getting those kids to be able to access a pre-K program. And they are popular, but there's still a high rate. I think I said that. But children in Baldwin County, ages 3 to 4, not enrolled in the pre-K program is around 57.6. So that number, obviously, we're trying to decrease that. Educators, health officials, all of that are trying to get these kids in school early. Okay, so local factors affecting health. Access to healthcare, like we talked about earlier. There's often a lack of access to healthcare for adolescents, and due to the lack of insurance, they're obviously not able to be seen. Like I said, we have the B clinic here, and it's helped a lot of kids be able to get that care, but obviously not everybody knows about that. Expenses, medical appointments, co-pays, all of that, and not having a way of transportation to get to those set appointments. Next is health and education programs. There are currently hundreds of programs put into place to increase the quality of life and provide young children with an education. However, the effectiveness of these programs can be lacking in some areas. This puts these individuals at risk of not receiving a proper education or receiving health care when they need it. So again, like I said, the more we educate these children early on about their health, the more they're going to be able to have a better quality of life overall. There's only so much we can do, but we can also be a voice for them. So that's something that Baldwin County is very much working on, and a local factor that does need some help. Economic status, because most of these children rely on their parents' incomes, there can be issues when it comes to nutrition, healthcare, transportation, and factors just like I said previously. Education, Baldwin County does their best to provide all students with the education they need and deserve. Although most children in this county are receiving education one way or another, mental health support in schools in Baldwin County needs to be improved. Mental health starts young. There's not really a set age of when these children will develop these mental disorders or, show signs of those. So that's another thing that really needs to be improved. I think talking about feelings, emotions while they're this young, 3 and 4, is a good way to start that. And that's what we do here. So just overall, all schools around Baldwin County need to be implementing that. Okay. So Family Connection, this is current work being done. Family Connection is a community organization that works on improving the overall well-being of children in the state of Georgia. This program does strive to keep children healthy and ready to begin school in order for them to fully thrive in that environment while they're having the best quality of life as possible. So they work with all, most family and community schools in Baldwin County. So that's an important piece that has helped us. Communities and schools, obviously, that is who I am interning for, and we just work to provide those students with a support system from the community and show them that they do have people, and they might not have that at home, but that we are, rooting for them, we're on their side, and we'll do anything to support them. So that's our mission. It also helps to empower kids to work harder in school, to get to their goals, to further their education. School-based health programs, obviously, kind of like the WIC program, obviously that was for like infants and younger children, but these programs support children from low-income households by providing them with free or reduced lunches and other services that will benefit them in their daily lives. In community partnerships, schools work with healthcare providers, businesses, and government organizations to provide kids with what they need. Okay, so local health priorities. There are a plethora of local health priorities for adolescents in Baldwin County. We've already kind of addressed some of these slightly, but the first big one, obviously nutrition. A lot of these kids don't have access to the correct, amount of nutrition or the right kinds of foods, don't have the money at home to pay for it. They don't, they're 3 and 4 here. They can't go drive a car and go get the healthy food that they need. So we try to do that here as best we can. But there is, some school systems do have to hunker down on that and try to help these kids get out of situations of where they're, gonna be obese or have type 2 diabetes or heart disease or this or that. So that's definitely the first thing. Also need to make sure they're getting exercise while they're on campus. We can't see what they do at home. So they might not be getting any exercise at home. So putting that in the school system, I think, is very, very necessary. And I feel like a lot of kids don't get enough time to exercise at school, even when they have recess or PE or whatever it is. So just trying to reform that. All right, accessibility to healthcare. It's one of the biggest pressing issues on this population. There's a set few providers here, and not a lot of specialists. You either have to drive to, Dublin or Macon or somewhere around there to be able to get that help. And so this is obviously not possible for those who don't have the money to get gas, don't have a vehicle, can't find a ride, can't pay for an Uber, that type of thing. So just trying to implement a way for children, even adults, to get cheaper and more affordable healthcare without having to go 45 minutes out of their way to get that. Health education programs is the last one. It's a massive need in this community. We just need to be teaching these kids while they're this age about healthy foods, about vegetables, about, my plate, those kind of things that we learn as we get older, starting at a young age. They might be able to implement that in their daily lives, or maybe they'll go home, they don't have healthy food at home, and they go home and say, Mom and Dad, I learned about fruits and vegetables today, can we get some at the store? If their parents are able to do that, they're starting a lifestyle for them early on. And these are my sources.